I'm going to hand this over to Dr. McNamara to give us the history of private equity in emergency medicine, and really how did we get here? How did we get to a point where we started out as a specialty designed to help the poor, and now we work for corporations that sue patients and garnish their wages, replacing us with non-emergency physicians.
Okay, thanks, Mitch. So it's interesting to hear Brad's talk. You can go back to a 60-minute show in 1993 by Mike Wallace, myself, Dr. Jim Keeney, the first president of AAEM, were on, where the issue of the quality of care in emergency medicine was discussed. At that time, it was, the use of physicians not specifically trained in emergency medicine, and now here we are talking about, sort of the same issues. With, is it a physician, is it a non-physician? So to put this in context, we have a crisis in emergency medicine. For the first time last year, EM residents couldn't find jobs. There's been a big study saying that we're going to have oversupply of emergency physicians. And, I think a lot of people here know that the specialty is dominated by corporations. Physician ownership has declined. And this has been slowly progressive over the years, and we'll talk about that, but now it's really at a critical level. And we really have a question here. What about the future? Some think it's bright. I think it's bright because we're probably, the specialty's in flames. So we're going to talk about these corporate groups. How did we get here? What exactly are they doing? Speak about their control over who sees the patient. And then hopefully, not to depress everybody, offer up some solutions, which I kind of talked about a little bit in the press conference. So we are in a crisis. I think this is the younger generations of emergency medicine's greatest challenge. I don't think anybody can deny now the negatives of corporate control of emergency medicine. That's what's been said over the years, quote unquote, corporate groups have been good for emergency medicine. I think it's finally revealed itself that the profits over patients is not good for us as a specialty, and certainly for our patients. I'm hoping that academic emergency medicine, I am an academician, been my whole career in academics. I hope other colleagues, we are protected. I actually have tenure. We are the people that should be speaking out for what is right for the patients and right for the physicians that we train to go out into the communities. And then certainly, what's emergency medicine going to do about this? What are the existing organizations going to do? And, why did Take EM Back get started? There's a void out there. This group here is pretty much focused on corporate control, private equity, and the effects of that on our ability to deliver the best care to the patient. So again, it's all rooted in money. It's all about the control of the professional fee. The private equity wouldn't be involved if there wasn't a big return on investment. And it's, for the physician, it's a substantial amount over their career. But more importantly, as I alluded to before, if you feel you're being taken advantage of, this is a career that you're not going to survive. Okay, we work 2 a.m., weekends, holidays. We take care of the sickest of the sick, the social ills. And obviously, I believe strongly this is a threat to the patients. The physician with moral injury is not going to be in the right frame of mind, but the physicians themselves and their family. Obviously, if you have a doctor who's, sliding down that pathway, they're going to be angry, and it's going to affect their family. So we didn't start out this way. I have a copy, and I believe it's on the website, Take EM Back. You can read the original bylaws of the first professional society formed in 1968. And, the purpose and function were all related to the private practice of emergency medicine, set the ethical standards, and preserve the integrity of private practice, as in physician to own. There were ethical statements made that you will not exploit your colleagues. You won't take the fees, a portion of the fee of another physician seeing the patient. So again, these are like, whoa, this is a great start. This is, you know, a specialty that looks like it's really going to do what's best for its membership and for the patients. And a Revin statement saying that you will not affiliate with anyone who will allow practice of medicine by a non-physician. Speaking right to the corporate practice of emergency medicine. Yeah, they did say that. But as we'll see, some early leaders who essentially saw that there was a potential gold mine in emergency medicine had a problem with this, and the bylaws were changed. They were actually stripped. The press itself was silenced. Now, by the press, I mean there was a lot of debate going on in the journals, letters being written saying, you know, hey, we got to do something about this, this situation, and I'll talk about a few of those. And then at the national meeting, the debate was shut off for antitrust concerns. And then an antitrust policy was written, which I believe tied the hands of the college. And there's been multiple statements of support about corporate emergency medicine, which are going to be hard to go back on. And I believe over the years, you know, it's linked to membership with the Residents Association. And I think that's been an effective way to suppress the voices of the young. And taking it back is coming from the younger generation. So it's interesting that we have this new organization started when, you know, when I was growing up, you know, through the 60s to 70s, it was the young that stood up and protested and acted for change. And in emergency medicine, we really haven't seen that, but now we are seeing it with taking it back. So as I mentioned, there were voices of dissent back in the 80s. Bob Simon, who was the chairman of Cook County in Chicago, he wrote a letter to the editor about entrepreneurism, where one or two individuals was taking advantage of the rest of the emergency physicians. And he said, look, if ACEP won't address this, perhaps we need new specialty societies that will. Mike Bresler wrote an editorial in the American Journal of Emergency Medicine entitled Feudalism in Emergency Medicine. I mean, essentially that where, you know, we were hired hands to make money for these national groups. You know, the quote says, you know, while the hired hands stay awake at night, wading through blood and other effluvia, their earnings are blatantly taxed as high as 50%. Again, creating a situation where there is a group of physicians who feel that they're being taken advantage of and exploited. But there was no organizational resistance. This was just happening. No one was fighting it. And in the same time, in the 1980s, we saw the rise of the contract management groups. Back then, it was MCare. Keeney worked for Spectrum, which later became part of MCare. Coastal Emergency Services, which is actually featured in that Mike Wallace story, In Good Hands. And then Southeast Emergency Physicians was formed. That's the forerunner to Team Health, which we will talk about. And then there were some other regional groups forming. So the first big move that took this from the physician-owned exploitation of one another into lay hands was when MCare was sold to Laidlaw in 1996. Now, Laidlaw, you know, it was a bus company. It was lay-owned. The seller was the owner of MCare, Leonard Riggs, the 1980 president of the American College of Emergency Physicians. He made $38 million selling his company. So Laidlaw could then go ahead as a lay company, make a 20% profit level off the physicians. Laidlaw then later turned us over to private equity in 2004, and really the door was open to private equity influence. MCare expanded. They merged with AmSurge, high CEO pay. And then in 2018, at the cost of $9.9 billion, they were acquired by the private equity firm KK&R. Now, one thing that's commonly said is that, well, you know, these groups are, you know, they're businesses, but, you know, the insurance is really the evil business. The insurers are the ones that are killing us as physicians, killing the patient. Well, you know, look at the executive compensation. The United Health Group, which a lot of us would point to as the insurer that gives us the most problems, their single CEO made $60 million but 4 KK&R executives that own Envision each made over 100 million. So I'm not saying, I'm not here advocating for insurers, but I'm saying this private equity we've allowed into our sacred space is just as bad, if not worse, than the insurance industry. I can't go through every group, so I'll spend a little time on team health as well with only a half hour, but this is, another story. This was a roll-up of multiple groups. We mentioned Southeast Emergency Physicians in Tennessee. They acquired a group in California, Fisher Mangold. He was the 1978 president of the American College up in the Pacific Northwest, Northwest Emergency Physicians, close to me and Philly here in New Jersey, a group called EPA. Now they're owned by the Blackstone Group. Okay, that was a $6.1 billion purchase in 2016. Mitch could update this slide. Schwartzman's wealth went from like 13 to 26 billion during the pandemic. He's the CEO. Emergency physician money, the care of patients at 2 a.m. is going to Schwartzman. He had his 70th birthday party, which was estimated to cost $20 million in Miami. With Gwen Stefani giving a private concert, camels on the beach, acrobats. We're there taking care of the homeless patient, and money is going to fund this kind of stuff. It just doesn't make any sense to me. It's morally reprehensible. So in recent times, the generation that came in after the Riggses and whatnot, these physicians have sold out. Physician-owned groups, large physician-owned groups. These are folks my age, in their late 50s, early 60s, who sold out to these corporations. The corporations, they have the cash. They want to buy up. They want to make more money. They want to grow by acquisition. So we have Premier, which was a physician-owned group, sold to Team Health, Emergency Medical Associates in mostly Northern Jersey, 380 million in MCare. And then a group that touted itself as, a giant physician-owned company, USACS, has had a private equity partner, which they recently, quote unquote, bought it back, but they did it by aligning with Apollo, which is another private equity firm, to get the money to pay for that. And they still have a couple members of Apollo on the board of directors. 2 other presidents of ACEP involved in these sales up in the Michigan area. ECI of Michigan, Robert Williams, 1981 president, and EPMG, Dr. Greg Henry, the 1985. So somebody asked a question in the press conference. We'll go into a little bit more detail. This is it. Physicians started it. They saw an ability, but now, we are owned by private equity. So these companies are completely controlled. The 3 of the largest, Team Health, Envision, Schumacher, and private equity has a major stake in a number of other groups. Even when the physicians claim they still have control. When I went to the private equity conference, they say, yeah, we let physicians think they have control, but we're actually the ones that do. So the estimates are over 40% are controlled by private equity backed, private equity connected contract management groups. And then if you look at the AMA study on, who's an employee doctor, who's working for somebody else, who's an owner, in 2018, we were the lowest of all specialties, and those who stated they were an owner are 26%. And the reason we got here is because we have a low practice overhead. Okay, we don't pay the electric bills. We don't hire the nurses. We don't have a physical plant. We don't buy the EMR, the computers. We go in as doctors. We see patients. We use our professional skills. The chart is filled out, and then the money's collected. And there's a 20 or higher % profit level in emergency medicine with very low overhead. And we were led to this, as mentioned, by those who had a conflict of interest. Now, there's something called aiding and abetting the illegal corporate practice of medicine. This has gone on. We've aided and abetted. I think we've also been complicit by inaction, by not stepping up and trying to challenge the corporate practice. I mentioned this case in a press conference. You can look it up. Brovo versus MCare. One physician in Texas allowed his name, his professional license, to be used to hold at any given time, 275 to 300 MCare practices in 20 different states. This is aiding and abetting KK&R through Envision to make money off of the patients we see in the emergency department. The physicians don't see what's billed and paid. They're not allowed to see that. The charges are inflated to 800 to 900% of Medicare rates. We are the cause, the private equity. This was a strategy to make more money. Go out of network, don't accept the payment from the insurance company, zap the patient with a giant bill. Cost to the patient and to the taxpayers increase. We, the physicians, are the number one expense. The board certified emergency physician. So if you're going to try to maximize your profits, you've got to try to eliminate that high cost. You can certainly try to get those physicians themselves to generate more income from you by pressuring them for charting patients per hour. You can have them supervise more non-physician providers and they feel is safe, and we certainly get those reports. I'm being asked to supervise 4 non-physician providers on a shift. I can't check on those patients. And then actual replacement of a physician with a non-physician provider or a cheaper doc, which, certainly the middle-aged physician who's, was seeing salary increases, this is industry. You're going to get bounced out of a job if there's a younger doc who's willing to come in and take your position for lower pay. So the oversupply. Again, this is an ad. This is the cold corporate world here. Hire Envision services. We're going to come in and staff your emergency department. Because look, we're going to use APPs, non-physician providers, because they cost 2/3 of what a doctor does. Another slide. This is extremely disturbing bullet. Employ the least expensive resource to accomplish the mission. And then ongoing saying APPs, non-emergency physicians, residents in training should be used, all in the name of profit. Cold, hard business things that affects the physician's role and the ability to provide the best care to the patient. So we're here. We need a healthy return, private equity. We're seeing some issues here, however. The insurers and the government are clamping down. United Health Group cut team health payments. They said, we've been giving you the 75 to 90% of charges, but we recognize that your charges are way out of line with what we're generally charged by an emergency physician group. So we're going to cut you to 15 to 20% of your charges. There's a lawsuit. Now, the lawsuits are actually filed by these sham professional associations, which when you dig in, are wholly owned and operated by Team Health itself. Dr. Smolenski mentioned ProPublica catching Team Health suing poor patients in Tennessee, calling them out. Therefore, we're not going to do that anymore. That's going to put a squeeze on them. And then the out-of-network billing, we're right now working through there was a legislative solution. The one that emergency medicine wanted resulted in a 9% drop in payments to emergency medicine across the board. So revenues are down. They're going to cut expenses. And the number one is the doctor costs. We're already hearing from doctors working for these companies that they've had pay cuts in the middle of the pandemic. They lost what was a benefit for continuing middle education. If you want a scribe to help you, accurately record what you're talking about, you're going to make you pay for that out of your your side, not our side. So these acquisitions, when you look at them, were heavily debt financed, and that debt obviously has to be paid. The private equity model generally requires a flip to another buyer. COVID-19, as we mentioned before, had an effect. It kind of revealed, the frail nature of what's going on. The finances, the volumes dropped about 30% across the country. And I believe the future of emergency medicine is at stake here. The other thing is, we need them to fight the insurers, but they now own EM practices. Okay, so any argument that contract groups are good for EM is now much, much less relevant. As Optum, which is a subsidiary of the United Health Group, bought Sound Physicians in 2018, along with a private equity partner, Summit. And if you know what happened with the insurance industry, they made out very well during the pandemic and are sitting on billions of dollars to acquire other physician groups. Now, what will happen? Will Team Health with these other companies that are looking to flip, are they going to go to insurers? So a little bit of pain, what can be done? I, can go into further discussion on this stuff, but there are legal and regulatory issues that present an opportunity. The corporate practice of medicine doctrine exists. Most states have some prohibition on lay entities, on private equity owning physician practices. And the whole act of fee splitting, of taking this 20+% profit level, okay, that is fee splitting. For the right to see a patient in the emergency department, a doctor is giving up 20+% of their fee. And that can be brought to bear as well. There are entities within the EM community that are supporting independent physician ownership, trying to restore some of that. I'm part of the AM physician group. There's groups such as the Independent Emergency Physicians Consortium in California. Independent billing companies have now gotten into practice management support as well. So the CPOM doctrine basically states at its core that businesses cannot employ a physician in order to keep the business interests out of the physician-patient relationship. Most states have some form. This sham professional association that I talked about has been ruled against in multiple court rulings. There's a couple in Texas. It's been ruled against in New York and New Jersey. And physicians themselves, these doctors like Dr. Byrne, need to be called out for aiding and abetting. The state boards of medicine should say, wait a second, you own this professional association. You don't even live or practice in that state, and you have no idea what's happening. You have essentially allowed a lay entity to use your license to run a physician practice in contradistinction to what the corporate practice of medicine doctrine in our state says. Fee splitting, basically, this is in the code of federal regulations. You cannot split your fee. I wrote an article where it showed that based on SEC filings that Team Health was getting 22% of the fee, at least with my calculations. The Inspector General has said that hospitals can't take doctor fees. Do we think that private equity can take doctor fee? So this again needs to be brought to the fore and used. And then importantly for us as physicians that are listening here, it's unethical. The highest ethical body, the Council on Ethical Judicial Affairs, says that we will not split fees. We will not take money from our colleagues, our professional colleagues. And way back in the day, that was also part of the original bylaws of the college. And even the college itself still today says that they're illegal. One of their publications saying when you give up more than fair market value for the right to work in an emergency department, you participating in fee split. So private equity cannot be part of the noble specialty of emergency medicine. That's sort of my simple value statement here. We take care of the most vulnerable in society, and it is just immoral to have private equity as part of that. So I will stop my share and be open for questions. Some apparently popped up in the chat. I don't know, Mitch, if you want to mediate these.
Thanks, Dr. McNamara. We have a few minutes for questions, so that is perfectly fine. I think we had mostly comments.
I'm not going to comment on the hooker one. It's sad. I mean, again, cog in the wheel, feeling like we're being taken advantage of. This is key to me. I mean, this is why I got into the whole business of EM thing when I read The Rape of Emergency Medicine. You do this job if you feel you're being taken advantage of.
Yeah, and that's Whit Fisher from Procedurettes, who will actually have an explainer video that he produced. And Whit likes to speak for himself, so he can use that kind of language, I think. But there's some real truth to it, to be honest. Arthur asks, what groups can do to avoid being sold? Many feel financial pressures and feel they have no choice. And to give that a little bit of context, I think, it's that Indiana group, one of the Indiana groups I spoke with, and they felt like, well, we're one of the most aggressively independent groups. And if we can't hold out, then who can? I've heard some depressing stories of even the younger docs saying, maybe they're a partner for 1 year and they're okay with selling out. So thoughts on how they can avoid that?
Well, I mean, obviously they've got to, try to do the best they can to run their business most efficiently. I mean, Arthur actually is part of the AAM physician group. There is assistance available from professionals to say, hey, are you maximizing what you're doing? Why do you feel that pressure to sell out? I mean, the core underlying issue here is, though, you're selling out to private equity. You are allowing a company to come in and to take over the practice that you built, and they're going to try to exploit you and the patient themselves. So it's sort of, this is the Hippocratic oath that you really, you got to take a step back. We know why people sold that. They saw, hey, nobody's stopping us. We're going to get a ton of money and we're close to retirement. And hey, this is the way it is. It isn't our fault that private equity got their foot into the door of emergency medicine. So it's a moral question for the specialty. I believe that, we do need some of these external pressures. We need the corporate practice of medicine to be fought. We need physicians who are aiding and abetting this to pay a price. I have reported a physician to the Texas Medical Board with one of my colleagues in Texas. We'll see how that goes. It's a moral quandary that we have. How much money do you need? I guess that's the question. I mean, maybe I'm the wrong guy to talk about it. I took the lowest paying job offered to me by going into academics. But I just don't see, as a physician, no matter where you work, if you're in a private group, you're going to make adequate income to, I think, meet the needs of your family. Why would you turn over the patients to an industry that really doesn't care about them?
Thanks, Dr. McNamara. And, as far as how much do we need to make, I feel like we do have a little bit of an upside down society with particularly, medical education right now. And, there's a growth of for-profit medical schools. Caribbean schools being extremely expensive. I went to a state school and ended up with $350,000 in debt while working my way through college and residency or in medical school. And then you come out the other end and you're stuck working for these corporations thinking society owes you and you need to pay that off. So I don't have simple answers for that.